Mr. Chairman, my speech covers the Ministry's initiatives to bring care closer to the community, how we are strengthening our environment and ecosystem for healthy living, and our efforts to improve our population's health. As our society ages, improving our population's health and preventive care is critical for longer, healthier lives. We have embedded preventive healthcare into the community through Healthier SG and HWell SG to support residents while they're still relatively young and healthy and as they age. Mr. Alex Yeo and Dr. Hamid Razak would be pleased to know that the development of Healthier SG care protocols related to frailty and functional health, such as for osteoporosis and dementia, are progressing well and would be rolled out in 2028. These care protocols will ensure evidence-based care is provided more consistently through Healthier SG general practitioners, GPs. Ms. Mariam Jaafar also spoke about improving community health, in particular the North region. Our data shows that in the North, the prevalence of diabetes and hypertension is above the national average, and residents engage in less physical activity. While we continue to review the reasons for these trends, we are simultaneously stepping up our preventive care efforts in the region. We will start off with Woodlands Town first. We will enhance the community health posts in the town. Secondly, we will improve access to specialist-supported care in the community. Thirdly, we will support residents to engage in healthy living activities by opening up community spaces for exercise programs, introducing digital wayfinding in Healthy 365, and empowering local community health advocates. As seniors age, visiting polyclinics and hospitals can be difficult due to mobility issues. Many also ignore symptoms that are not yet serious or urgent. Consulting a healthcare professional early can lead to early identification of issues, which in turn leads to earlier intervention and better health outcomes. We agree with Dr. Harish Singaraju's view that it is important to connect patients to community resources, and we are enhancing accessibility of health services by bringing care directly into the community. I'm pleased to announce that NHG Health has been progressively enhancing 11 community health posts, CHPs, across Woodlands Town since the start of this year. These enhanced CHPs, which are located within active aging centres, AACs, will be open once a week. All residents, including non-seniors, can walk in to these enhanced CHPs to access services such as general health advice, basic health assessments, and social prescriptions, which include linking up residents with community programs and resources, support for preventive health and disease management, including health coaching, medication review, and chronic disease and frailty management programs, and support for caregivers and post-discharge follow-ups for patients returning home from hospitals. These services are provided by NHG Health's community health teams, comprising community nurses and health coaches who will bring in pharmacists, dietitians, and therapists based on residents' needs. They also work closely with GPs in the region and healthcare professionals in hospitals to provide coordinated care for residents with chronic diseases and frailty. For example, residents with diabetes receive ongoing support at enhanced CHPs through glucose monitoring and personalized health counseling, with the community health teams regularly updating the residents' specialist doctor on their progress and any changes in their condition. This ensures interventions can be made early if needed. For seniors who are already at the AACs for programs, they can also consult healthcare staff easily without needing to make a separate visit. We have also noticed that some patients miss specialist appointments due to work schedules or limited mobility. To address this, Woodlands Hospital will launch a new initiative starting end of this month to provide specialist-supported care for patients in the community through the enhanced CHPs in Woodlands and direct teleconsultations with individuals. Starting with diabetes and asthma, selected patients can choose to receive specialist-supported outpatient care at an enhanced CHP through teleconsultation with the hospital care team. Instead of travelling to Woodlands Hospital for their appointment, they will be able to see a health coach or nurse at the enhanced CHP to manage their condition and will receive support from the specialist doctor through teleconsultation. With regular monitoring of health conditions, nurses are able to pick up early signs of poor control and work with specialist doctors for early treatment and help patients avoid unnecessary hospital admissions. Woodlands Health has also started rolling out teleconsultation for selected patients who have undergone colonoscopy screening with low-risk screening results. Instead of making a trip to Woodlands Hospital, patients can choose to teleconsult their specialist doctor from anywhere, including at the CHP if they need help. This option will be further expanded to other specialities and procedures in Woodlands Hospital. With these services, patients will be better supported by the community care teams in their neighbourhood while requiring fewer visits to Woodlands Hospital. This will help patient access required care in a more flexible way while working around other commitments. NHG Health estimates this will save about 500 physical specialist outpatient clinic visits. This is expected to increase further as the initiative expands. Even as we are bringing healthcare services closer to the community for greater accessibility, we agree with Ms. Mariam Jaafar that health begins with individual choices, and we can design a healthier ecosystem to support individuals to make better personal health choices in different settings. One key setting is the immediate neighbourhood that residents live in. The Health Promotion Board conducted a study and found that residents are more likely to participate in health activities held in everyday surroundings that are accessible, green, and fit seamlessly into their busy lives. They also value social experiences that are fun and community-driven. These insights point to the need for a collaborative, ground-up approach with local community partners. They understand both residents' needs and preferences and the community spaces within the neighbourhood. They also play critical roles in facilitating access to neighbourhood facilities and spaces, encouraging participation in activities, and building social connections that will make healthy living appealing and sustainable. Thus, HPB will work with local community partners so that residents will find it easier to access and participate in healthy living activities. From April 2026 onwards, more residents will be able to join workout and exercise sessions in familiar, convenient and spacious locations, including community halls, plazas and malls near their homes, such as 888 Plaza and Fuchun Community Centre. In tandem with holding more activities in the community, we will help residents explore and make greater use of existing neighbourhood amenities themselves. HPB will enhance the Healthy 365 mobile app with wayfinding and gamification features to connect residents to nearby opportunities to stay healthy and active in their everyday environment. For example, residents may be prompted to complete a brisk walk along park connectors or trails within their neighbourhood and complete digital check-ins at designated points. This feature will roll out progressively from June 2026. Residents can continue to receive rewards when they track their participation via the Healthy 365 app. Beyond infrastructure, what will be key is the software, the networks and the bond of the community. We want residents to look out for one another and encourage relatives, neighbours and friends to participate in healthier lifestyles that will build healthier people and healthier towns. HPB will support local community stakeholders who have deep understanding of residents' needs and community resources to co-design healthy lifestyle programs. This includes developing a citizen-centric playbook from June 2026 to help partners effectively plan relevant activities for residents. Through collective ownership, residents will benefit from healthy lifestyle programs and activities that are tailored to them. We will also jointly monitor progress to continually refine and improve on the initiatives. HPB will explore how to expand successful elements to other towns. Besides ground-up, community-led initiatives, we are looking at ways to mitigate lifestyle risk factors to improve the health of our people. One example is a cohort smoking ban or tobacco-free generation policy as mentioned by Ms. Herting Roo. This means to restrict access to all tobacco products for a specific birth cohort onwards. Through our current multi-pronged approach of policy measures, public education and cessation support, we are making good progress in reducing the prevalence of smoking. Prevalence has declined over the years to 8.4% in 2024 and even lower in young adults aged 18 to 29 years at about 5%. We are also continually reviewing our tobacco control policies, including the tobacco-free generation policy, which some other countries are exploring. Adopting a cohort smoking ban requires serious consideration. We remain open to the policy and will study its effectiveness, impact, and how it may be implemented in Singapore's context. MOH is focusing our attention on combating the scourge of vaping. Hence, for now, we will continue to monitor international developments and learn from the experiences of other countries in how they implement a cohort smoking ban. Mr. Chairman, allow me to say a few words in Malay. Pengamalan gaya hidup yang lebih sihat merupakan sesuatu yang perlu kita usahakan bersama-sama dengan masyarakat kita. Tinjauan Kesihatan Penduduk Kebangsaan 2024 menunjukkan bahawa ada beberapa aspek yang perlu diperbaiki. Pertama, mengenai pemeriksaan kesihatan. Pemeriksaan kesihatan penyakit kronik dalam kalangan penduduk Melayu menurun hampir 10 mata peratusan daripada 64% pada tahun 2019 kepada 55% pada tahun 2024. Kadar pemeriksaan barah payudara telah jatuh daripada 29% pada tahun 2019 kepada hanya 18% pada tahun 2024. Apabila keadaan kronik dan barah tidak dikesan awal, komplikasi serius akan timbul dan ini memerlukan rawatan yang lebih intensif dan mahal. Saya faham bahawa topik mengenai pemeriksaan kesihatan boleh menimbulkan kebimbangan. Sebab itu, baik jika kita mempunyai petugas kesihatan yang dipercayai dan ditempatkan di persekitaran estet kita sendiri untuk membimbing kita. Dalam masyarakat kita, masjid-masjid merupakan tempat yang sesuai untuk mengadakan sokongan ini. Oleh itu, saya dengan sukacitanya mengumumkan bahawa 2 masjid di Woodlands, iaitu Masjid An-Nur dan Masjid Yusof Ishak, bakal bekerjasama dengan NHG Health untuk menyediakan perkhidmatan pos kesihatan masyarakat, Community Health Post, menjelang September 2026. Pelbagai perkhidmatan seperti nasihat kesihatan am, penilaian kesihatan asas, sokongan untuk gaya hidup sihat, pencegahan dan pengurusan penyakit dan susulan selepas discharge akan disediakan. Kami akan menyesuaikan perkhidmatan-perkhidmatan ini mengikut keperluan masyarakat kita. Contohnya, perundingan boleh dijalankan oleh jururawat masyarakat dan jurulatih kesihatan yang fasih berbahasa Melayu untuk membantu mengurangkan masalah komunikasi terutamanya untuk warga emas. NHG Health juga akan mendapatkan maklum balas daripada para asatiza untuk memasukkan bimbingan berasaskan keagamaan ke dalam bengkel kesihatan. Dengan menyediakan perkhidmatan penjagaan kesihatan di tempat-tempat yang biasa dikunjungi serta dengan kerjasama pemimpin agama dan masyarakat, penjagaan kesihatan akan menjadi lebih mudah diakses oleh masyarakat kita. Untuk menggalakkan penyertaan pemeriksaan kesihatan dalam masyarakat Melayu Islam kita, sejak Mei 2025, Lembaga Penggalakan Kesihatan atau HPB telah mencuba program baru iaitu Jom Check. Program ini menyediakan sokongan individu dalam suasana kumpulan kecil untuk membantu penduduk mendaftar dalam SG yang lebih sihat, Healthy SG, dan membuat temujanji pemeriksaan kesihatan. Ini dilakukan dengan kerjasama pelbagai rakan kongsi kesihatan. Setakat ini, 16 sesi telah dianjurkan di seluruh negara menjangkau lebih kepada 300 penduduk. Kami telah menerima sambutan yang positif. Oleh itu, HPB akan meningkatkan skala Jom Check dan menjangkau dan memberi manfaat kepada lebih ramai penduduk. Mengambil tindakan kecil untuk menjalani pemeriksaan kesihatan secara berkala sekarang boleh mengelakkan masalah yang lebih besar pada masa hadapan. Ini lebih mudah dilakukan dengan Healthy SG kerana pendaftar yang layak boleh menikmati subsidi khas untuk ujian saringan Healthy SG. Kini kira-kira 57% daripada mereka yang layak telah pun mendaftar dengan Healthy SG. Peratusan ini lebih tinggi untuk golongan yang berumur 60 tahun ke atas pada kira-kira 70%. Masyarakat kita juga telah menunjukkan peningkatan dalam kadar pendaftaran yang tertinggi dalam masa 1 tahun ini. Ini amat menggalakkan. Bagi mereka yang belum mendaftar, saya amat menggalakkan anda untuk mengambil langkah penting ini dan mendaftar hari ini. Isu kedua adalah obesiti. 32% atau kira-kira 1 daripada 3 orang dalam masyarakat kita mengalami masalah obesiti, peningkatan hampir 10 mata peratusan daripada 24% pada tahun 2020. Ini menimbulkan kebimbangan yang besar kerana obesiti meningkatkan risiko menghidapi pelbagai penyakit kronik. Tinjauan pemakanan kebangsaan menunjukkan bahawa pengambilan kalori serta makanan minuman manis paling tinggi dalam kalangan masyarakat kita. Kita juga mengambil jumlah lemak tepu yang tertinggi. Ini mungkin disebabkan oleh penggunaan minyak masak yang berlebihan. Walau bagaimanapun, saya yakin kita boleh membuat perubahan kecil dan berterusan yang selaras dengan gaya hidup dan budaya kita. Sememangnya dalam budaya dan agama kita, keseimbangan itu penting. Menjaga tubuh kita adalah satu amanah. Maka itu, mari kita sama-sama kurangkan pengambilan gula, sodium dan lemak tepu dan lebih memakan makanan yang sihat dan seimbang. Pemerintah bersama-sama dengan MOS, Mendaki dan PA Mesra melalui M03 dan rakan kongsi daripada rangkaian Jaga Kesihatan Jaga Ummah JKJU akan memainkan peranan mereka untuk terus menyokong usaha-usaha meningkatkan kesihatan dan kesejahteraan masyarakat. Saya berasa terdorong melihat kemajuan secara beransur-ansur dalam masyarakat. Melalui usaha bidang tumpuan kelima atau FA5, lebih daripada 90,000 orang telah mengambil bahagian dalam pelbagai program pada tahun 2025. Kini kita dalam bulan suci Ramadan dan ia adalah peluang yang baik untuk masyarakat kita berazam menjalani gaya hidup yang lebih sihat. Kita akan terus bekerjasama dengan rakan kongsi untuk menjangkaui masyarakat. Ayuh semua ambil langkah pertama hari ini. Daftarlah untuk satu program kesihatan. Mr. Chairman, our goal is to ensure that the path to a healthier life is wide enough for everyone to walk on. Through our initiatives, no one has to navigate the health journey alone. By working hand in hand with our community partners and residents, we can build a Singapore where healthy living is inclusive, accessible, and a lived reality for every one of us. Thank you.